Right. Thank you, everyone, for joining so punctually. And good afternoon, good morning, depending on where you're joining from. I think we'll go ahead and get started because we have a lot of exciting things to cover and only 1 hour, unfortunately, while we wait for other participants to kind of join in. So just some kind of opening remarks from my side as the facilitator of the session. My name is Naina. I'm with Impact/Reach. For those of you that don't know us, we are a research organization based out of Geneva, but also with a field presence in about, I think, 25 plus countries at the moment. I'm also joined by a lot of exciting panelists who I'll introduce you to in a second. But before that, I just wanted to kind of talk through a bit why we decided to organize this session and what we hope to achieve. So we as a research organization, obviously for us, but for all other aid actors, last year was quite challenging. It brought a lot of unprecedented challenges in terms of accessing crisis-affected communities, trying to continue producing information and knowledge so we can inform decision-making in these crisis contexts. Quite early on, as Impact, we had to, speaking from our experience, we had to adapt our ways because a lot of our work was directly related to access to the population, collecting data from households or from key informants pretty much face-to-face. But for us, the priority was always safety of the community, safety of our data collection teams. So we tried to find ways to kind of adapt so that we can still produce information that's relevant for decision makers. We have an SOPs that's available on our website that you're welcome to refer to. And this is something we also had reviewed by kind of experts at WHO. Of course, Impact was not alone. There are a lot of other organizations that were on the same boat, which is why we have this very exciting panel who will talk through their experiences and lessons learned as well. Something kind of to think about of the objective of the session. So we are looking at solutions and lessons learned from last year in a very specific context. But you can see in the session title, we put "and beyond." So we're really thinking of things that ways you can identify opportunities, how we can actually bring these lessons learned, these solutions, the ways we've adapted into future research efforts as well, and any kind of challenges that are related to that. So that's kind of just a very, very quick overview of what we had in mind. Before I introduce the panel, just a couple of logistic points that Emmanuel, my colleague, has already posted on the chat. If everyone could stay on mute throughout the session, just to ensure we have minimal interruption, and if you could also keep your videos off, except the panelists, just to ensure we don't have too much connection disruption. We will have a Q&A session. So as you hear from the panelists, if you want to ask them anything, please do post it on the chat window, and we will of course come back to that at the end of the presentations. Now, just to introduce you to who we're joining and what we'll be talking about. So we have a very exciting panel today, joined by four colleagues. So you will hear from April, who's a policy manager at JPAL, who will talk a bit about specifically challenges that JPAL faced due to COVID-19, but also how they adapted both their data collection methods, but also areas of research that they are focusing on. Matthew will give an interesting example that's actually pre-COVID, but also highlight how this could be quite interesting and relevant when access has become even more difficult for humanitarian action. And then we'll have Louisa and Mele from IDMC and Reach Libya, respectively, who will talk about some online data collection solutions that they've explored last year. IDMC specifically on the impact of COVID on internally displaced populations in Yemen, and Mele will talk a bit about online focus group discussions to collect information also from the population in Libya. So as you can see, a lot of interesting things, and you'll hear from all of them about their different experiences. Before I hand over to the panel, I kind of wanted to do a live poll very quickly with the audience, just to get a sense of how many of you share similar experiences, but also what you're hoping to take away from the session. And we'll be very curious to hear that. So we're going to use Slido if you're familiar with it. I'm not sure, but it's pretty straightforward. You can go to slido.com, you enter the key that's on the screen that you will also see in the next slide, or you can scan the barcode that I will show you on the next slide as well. So I'm going to just pop that up. So if you want to just get onto that platform. I hope it will work for everyone. I'm going to do it too. And once you're in there, the first question is to understand how challenging was it for you personally or your organization if you were conducting research last year with the developments of COVID-19. So you have four options there. You can also choose not applicable because you do not work in research at all. I'll give it a few seconds for everyone to get their answers in. Okay, so we don't have not at all challenging. Just expected. We have 22 responses so far. I'll wait if there's anyone else. Okay, so we have about half the participants that have answered, and the most common seems to be somewhat challenging. There were quite a few obstacles, but somehow you managed to find a good enough solution, which I think is the case also for us, but also for the panelists, as you will hear from them. Relatively a small number of you think it's very challenging, but that's also interesting. All right, then before the next question to answer is just to understand what the audience, those of you who have joined the session, you want to take away from the session. So it's an open question. In a maximum of 3 to 5 words, you can put what you think is the main takeaway you hope to get from the session. So is it lessons learned? Is it ideas for future research? Is it to, I don't know, whatever it is, the reason that motivated you to join the session this afternoon? We'd be very curious to hear that, so we can also come back to that. Okay. Love me some data. That's a nice answer there. Okay, so we can definitely see a theme emerging there in terms of best practices, innovation, lessons learned, also some questions about data security, technological solutions. So that's really great because that's exactly what we'll have our different panelists talk about. So really nice to see these responses coming in. Okay, I'll close the poll now so we can go ahead with the session. I think first we're going to hand over to you, April, to talk us through the experience from JPAL.
Great. Let me just go ahead and share my screen. Are you able to see it okay?
Yes, all good.
Great. Great. Well, thank you so much for having me. As Diana mentioned, my name is April Knox, and I'm a policy manager at the Abdul Latif Jameel Poverty Action Lab, or JPAL, where I manage our team's work specifically to crime, violence, and conflict. And for those of you who might not be familiar with JPAL, we're a global research network of mostly economists based out of MIT. And our mission is to reduce poverty by leveraging insights based on scientific evidence. And this is obviously more important now than ever, as it's estimated that an additional 150 million people will be pushed into extreme poverty as a result of the COVID-19 pandemic, based on some recent estimates by the World Bank. So as with all other organizations, beginning in March, JPAL was forced to rapidly adapt its policy and research efforts as a result of the pandemic. On a very practical level, our first response was to suspend all in-person fieldwork. For obvious reasons, we wanted to minimize face-to-face contact to ensure the safety of our staff, researchers, and human subjects. But also in recognition that many pressing policy questions have emerged in the wake of COVID, we quickly began to develop best practices on how to resume data collection in safe and secure ways that wouldn't put people's health at risk through remote surveying technologies that leverage mobile phones, social media, and other online platforms. Then with these new protocols in place for safely conducting remote research, we also quickly began to explore new research questions that were relevant to COVID response and recovery. Many projects that already were underway prior to the onset of the pandemic actually pivoted to start collecting information that was relevant to thinking about how to respond to COVID and promote recovery. And then finally, we also sought to leverage our existing database of evidence in order to inform strategies to either slow the spread or mitigate the negative impacts of COVID-19. So we worked with governments, NGOs, and many other actors on a range of themes like take-up of preventive health products and behaviors, education technology and the transition to remote learning, targeting and delivering social protection, and shifting norms around gender-based violence. As we've rapidly adapted to remote surveys, there are a number of lessons that have emerged to ensure high quality data collection, many that are quite intuitive, but some that I'll just quickly note. First, keep surveys short, ideally no more than 30 minutes. And so it's really important to test which questions are actually most important and to cut repetitive modules where possible, which can often be a challenge, especially for economists who want to just ask so many questions. Also, dedicate time to training. Remote surveying presents unique challenges in terms of keeping respondents engaged and adapting to interruptions. And so therefore, building these sort of interpersonal skills amongst enumerators is really key. Also, continue to monitor data quality. This becomes more difficult in remote settings, but there are solutions, including things like sometimes recording conversations to check for accuracy, depending on the content that's being discussed. Potentially doing daily debriefs with enumerators, or also just finding other ways to add additional support to enumerator teams so that they can be checking in and making sure everything's going smoothly. Also, timing is key. Morning and evening hours are often better for reaching people. And so relatedly, survey or working hours should be flexible to accommodate this. And you should be willing to kind of check in multiple times and have a protocol in place of how many times you're willing to check in before you move on to a new respondent and replace that respondent in your sort of sampling pool. Also, make sure to get local buy-in. So having support from local authorities or other partners may make respondents more likely to pick up the phone and to dedicate time to speaking with the research team. And then finally, just pilot. Make sure to test and innovate and get to the questions that are most important. So there's a lot more guidance you can look into. I've included a link here below, and I can also put in the chat for other best practices. And with these best practices in mind, I also wanted to quickly highlight a couple of examples of new research underway, both focused on different strategies for actually tackling gender-based violence, so a little tangential to the humanitarian space, but I think have some relevant lessons. And I focus on these examples just given spiking rates of IPV that we've seen in response to the pandemic. So first in Peru, Erica Fields and Javier Romero are running a phone survey with couples to first understand the impact of COVID-19 restrictions on intimate partner violence and intra-household conflict. Also to characterize couples at heightened risk of IPV as a result of these measures in order to increase understanding of risk factors and to inform the government's response. And then also to evaluate the efficacy of an SMS intervention that's designed to help men manage emotional regulation when facing stress. And this campaign draws on psychological interventions that are designed to help individuals at risk of violence better manage impulse control and channel emotional outbursts. And what's unique about this project is that it spins off of a long-term relationship that the researchers have built with the Peruvian Ministry of Women and Vulnerable Population, which unfortunately a lot of the programming that they were doing had to stop at the start of the COVID-19 pandemic, but this created space to explore alternative interventions with the potential to still reach their populations of interest during lockdown. The second study in Colombia by Horacio and Atanasio and co-authors is also taking an interactive phone-based approach using WhatsApp as a delivery platform. And specifically, this intervention provides families with knowledge and tools to manage their scarce financial resources, as well as communication strategies to manage partner relationships and planning, and customized information and support, including on things like the COVID emergency. And the goal here is to gather evidence on an effective behavioral intervention that can mitigate violence in the short term, but also lay the base for financial resiliency that could serve as a model for both current and future crises. And just a final note that I want to make sure to point out is that it really is important to acknowledge that when it comes to research on gender-based violence, and especially intimate partner violence, collecting data has always been a challenge. It's an incredibly sensitive topic, and necessary precautions really need to be taken in order to ensure respondent safety. So that said, there's been a lot of consideration when thinking about conducting evaluations on interventions being implemented to address IPV during COVID. On one hand, it's really important to understand the true costs of lockdowns and the impact of different mitigation strategies in order to sort of inform future response. But on the other hand, remote survey tools could increase risks to respondents and may not precisely measure IPV when outcomes are often self-reported. So our colleagues at Innovations for Poverty Action and the Sexual Violence Research Initiative have put a lot of thought into how to effectively and ethically conduct research on these topics during COVID. So you can see a link here, but happy to talk a little bit more about that during the Q&A as well. So thanks so much. I'll hand it back over to everyone else. Let me figure out how to stop sharing my screen.
Thanks, April, and thanks for that very, very interesting example, specifically also highlighting that collecting data on GBV, IPV has always been a challenge, but it's also extremely important. It is an emerging issue, and that research had to be done, and for highlighting some solutions from JPAL's side to continue feeding this very important information gap. Thanks a lot, April. I'm sure there'll be some questions for you later on, so we'll, in the meantime, pass over to you, Matthew, to talk a bit about voice ID technology in Somalia, right?
Apologies there, finding unmute whilst on presenter mode proved to be a slight technical challenge.
Wild. I ordered these shoes on Saturday, and then on Sunday, we discovered Emmanuel's. Sorry.
Can everyone please mute themselves? I hear. Okay, thank you. All right, sorry, Matthew, go ahead.
No worries. Yeah, so hi, thank you again for having me. Very excited to speak. For those who don't know, my name is Matthew. I'm a Senior Insights Manager at the GSMA in our Mobile for Humanitarian Innovation team. The GSMA is the Global Trade Association for Mobile Network Operators. We represent the interests of more than 750 operators, but the Mobile for Humanitarian Innovation team specifically is a UK aid-funded program looking to accelerate the rollout of impactful and appropriate digital humanitarian services. I should say we're not an implementing agency, so we have the benefit of working with a large number of partners across the humanitarian and telecommunication space. And a number of those projects fell under this bracket, but with just 5 minutes to speak, I want to talk you through a project we've been working on in partnership with Telesom and Care in Somaliland, using interactive voice response and voice biometric data to collect verification monitoring data for cash programs. And in the hope it could be interesting for others, and keen to hear people's questions and thoughts and talk about the broader experience of the GSMA as well on the panel today. So first of all, a bit of a background. So like I said, we've been working with Care Somalia and Telesom, the leading mobile operator in Somaliland, to overcome some challenges that the Care team were facing around verification. Even pre-COVID, going into the field was resource intensive and had security issues in a number of the regions, and the Care team wanted to find a technological solution to make this work. And then through COVID, what it's also done is heavily reduced the number of physical contact points, which obviously is preferred in the environment. So with this challenge, the GSMA convened the partners to explore a number of the solutions. They brought other stakeholders to the table from other contexts to work through technology options. And we settled on what we've called voice ID, which is this combination of voice biometric data with interactive voice response, which we've been piloting through the last year. In a nutshell, what this means is that during registration, so this is a mobile money cash voucher assistance program in Somaliland. And during initial registration, the head of household records a voice password. So this is simply saying my voice is my password or something similar, something easy for them to remember. And this acts as a password for them and a key. So then on payment day, the head of household will receive an SMS saying, it's payment day, in order to receive your money, please call the hotline and provide your password. And what this does is it means that every single head of household verifies that it is the right person receiving the money. We saw up to 95% verification, which is notably higher than a number of cash programs. And it also gives recipients the power to trigger the payment themselves, so they're not waiting all day for it. They can choose a moment that's convenient for it to come onto their account and move forward with them. Through 2020, we evaluated this. You'll see a quote on the left from one of the recipients. It was a really well-liked technology. People liked that it gave them a bit of authority, and it kind of brought the whole process onto their phone, which during a mobile money cash assistance program is great. And it led to notable savings in both time and resource for the care team. But what I think is probably most interesting for people on this call is the data itself. So what this meant is that, and I should say, what I think was really useful about this is by complementing the voice ID with interactive voice response, this is a totally automated solution. So there is no one making the phone calls, there is no interviewer, and it's triggered by the respondent. So it's what we would call a pull mechanism. And what it's led to is high quality evidence demonstrating that cash goes to the intended recipient. So if you're a cash programming person, this is one of your biggest indicators, right? Which is, did we send the cash to the right person? But because you're leveraging interactive voice response, which is quite a popular technology for surveying, you also have the potential to add one or two, I wouldn't recommend more because it's a touch point that everyone goes through, questions. So you can collect a couple of very key monitoring indicators. And because it's overlaying a mobile money cash program, every single household has a SIM card, which means really you can be looking at census coverage data with your survey questions, which I think for most programming is not very likely. So by creating this touch point, which people like to do, and adding some survey questions in, you're looking at census coverage for key monitoring indicators. Now, I don't want to say that it's perfect, so that we know through the evaluation there are a number of bugs that need to be worked through. So, for example, some persons with disabilities or people who get a cold 1 month, for example, it can struggle to kind of get the voice ID to recognize them. But this is something that we continue to train the algorithms with, and there is plans to overcome. And I guess to reflect on why it works in this context so well is, again, coming back to the fact that we know every household by design has a SIM card, so this technology can reach every household because it's been distributed. If you wanted to utilize this kind of technology in other programs where there wasn't 100% coverage of SIMs, you would need to understand what are the access gaps. Are women-headed households, are households with older head of household, or going into the household linking an individual level, like who has access to phones and who doesn't, because this will really impact the kind of data you're getting back. A topic I'd love to kind of come back to on the panel. We have a lot to say around these access gaps and thinking through the use of technology to speak to people and what it means. But yes, I think I have a suspicion I'm at my minutes, so I'm going to say thank you there. And again, happy to take any questions and keen to hear from others as well. Do you want to get to the Q&A?
Thanks, Matthew. And no, you're actually perfectly on time. So thank you for sticking to your 5-minute windows. Especially, I know it wasn't easy. We discussed quite a lot of interesting solutions to share, and you had to pick. So thank you for obliging us. But definitely would encourage everyone to look at the links that April shared and also the GSMA website. There's a lot of interesting work that's going on. I think April, from Matthew, we also saw that sometimes technology scares us, but it could work in specific circumstances, and it could make something like monitoring of cash-based interventions so much more efficient, even in a context as complex as Somalia. So thanks to you, Matthew, for highlighting that. So now we move on to you, Louisa, to talk a bit about your online survey in Yemen. And yeah, over to you. We can see your screen.
Great. Thanks a lot, Nayana, and thank you for having me. My name is Louisa Yasukawa, and I'm a research associate at the Internal Displacement Monitoring Center. And we're based in Geneva and are a source of data and analysis on internal displacement worldwide. So building on April's discussion of the use of remote surveys, my presentation will focus on the use of remote online surveys to better understand the needs and vulnerabilities of internally displaced populations. So prior to the pandemic, IDMC had developed an original survey tool which we had used in several countries to measure the socioeconomic impacts of internal displacement on IDPs and local non-displaced populations. Although we would normally collect this data in person, COVID-19 restrictions prompted us to adapt our existing tools and to develop a remote online survey to investigate how COVID-19 has impacted the health, livelihoods, housing, education, and security of IDPs and non-displaced people in Yemen. The survey was conducted by the Canadian-based company RUI, which uses innovative technology to deliver anonymous opt-in surveys to web users while they're surfing the internet on their smartphones or desktop devices. All internet users above the age of 18 in Yemen had an equal random probability of coming across the survey. Now, there are several advantages of this type of method. Firstly, it's quick and easy to run and does not require enumerators. It's also safe for respondents and is designed to be completed in under 15 minutes. Despite being entirely voluntary, the response rate was also high, and over 1,600 people completed all 14 questions of the survey, including 381 IDPs displaced by conflict, violence, and disasters. The findings suggested that COVID-19 has had a negative impact on most of the respondents. As anticipated, we saw that many of the consequences have been more severe for IDPs than for non-displaced people. So in terms of the virus itself, we saw that 45% of surveyed IDPs said they or a household member had experienced symptoms of COVID-19, compared with 30% of non-displaced people. At the same time, in terms of when asked why they hadn't received treatment, more than half of IDPs said they hadn't received treatment for their symptoms because they could not afford to, compared with a third of non-displaced people. We also saw that in many cases, the impacts of the economic downturn associated with COVID-19 had been more severe for IDPs. So here in this graph, you can see that in terms of the impacts on housing, here we have in the darker blue color, 14% of IDPs said that financial difficulties linked with COVID-19 had already forced them to leave their home, which was twice the figure than non-displaced people. We also saw that around 1 in 3 IDPs said that they feared that financial difficulties would force them to leave their homes, which compared to around 1 in 5 non-displaced people. And similarly, the findings for education also showed how IDPs have been particularly impacted. So here we can see that more than half of the IDPs said their children had been out of school as a result of COVID-19, which was higher than the non-displaced population. And when asked whether they thought their children would ever go back to school, around 42% of IDPs said they simply didn't know. So these are just a couple of examples of the types of findings that we gathered from the survey, and I can post a link to a blog with further details of the study. And we also have a dedicated paper on Yemen that we're about to publish, which you can find further results from. So there are, of course, limitations of this type of method, including the fact that it's limited to the internet using population. So this means it excludes people with no internet, or perhaps people who are illiterate or who have a disability who may not be able to take part. Given the digital gender divide in Yemen, this also meant that the respondent pool was largely male. Although we expected that this would also limit the responses to people living in urban centres due to better internet connectivity, we actually saw that nearly 1/5 of the respondents were living in rural areas. And importantly, we were still able to reach a significant number of IDPs, both living inside and outside of IDP sites. Given the online survey is quick to run, is remote and easy to design, it is particularly useful if you need to conduct a rapid assessment, or for instance, if it's not possible to go to the field for security reasons or cost constraints. All in all, we found it a very useful survey to gain a snapshot of the needs of IDPs and highlight areas where further attention and research is required. We're already using it to collect data on IDPs living in other displacement contexts, and I have no doubt that we'll continue to use it during the pandemic and beyond. Great, so I'll just leave it there. Thank you.
Thanks, Louisa. I really like the ending there on the and beyond. And thank you so much for highlighting also that there are challenges, of course, that come with this method, but they could be appropriate to get a snapshot. And very interesting that you still managed to get some rural coverage, even in Yemen. So definitely I'd be reading more about this as well. I can see already some questions pouring in, so just hold on to them because we have one last panelist to share her experiences from Libya when we conducted online focus group discussions. Over to you, Mally.
Hi, everyone. So my name is Nella. I work with REACH in Libya for the Libya mission. And I'll do a very, very quick presentation on conducting online focus group discussions or online FGDs in humanitarian contexts, focusing specifically on the online FGDs that we conducted in Libya last year. Before I dive into that specific example, though, I just want to give a brief overview of online FGDs in general to highlight the versatility of this modality, as there's really very many ways to approach it beyond the specific modality that we ended up choosing for our assessment in Libya. So in general, online FGDs are becoming more and more popular for marketing research in Europe, but not so much for humanitarian contexts, despite the fact that there are significant benefits primarily related to access. So in our case, we didn't have physical access to our population of interest because of COVID, but there might be a multitude of barriers to physical access where online FGDs can be a really good alternative. When approaching your online FGDs, there's two main sort of dimensions to consider when choosing your specific method. So on the one hand, you have timing, where you can have asynchronous discussions or synchronous discussions, meaning in real-time communication or not real-time communication. And the other dimension would be your method of communication. It can be text-based or video-based. This is not a comprehensive list of options by any means, because there could be a mix of any of these kinds of methods. But just to give an idea of the general things to think about when setting up an online FGD and what kind of method is going to be best suited to your research. So key things to think about, key considerations for when you're looking at whether you're going to do asynchronous or synchronous online FGDs, for example, is internet connectivity. So in our case, we're dealing with a context where it's very unlikely that our entire group of participants is going to be online at the same time. So very quickly, synchronous online FGDs were not going to be an option. Other things to think about are the kind of technology that your population of interest has access to, as well as digital literacy if your population of interest, literacy in general. And I won't go through the full list here, but in general, it also will come down to what your research questions are and what kind of questions and answers you're looking to ask. So in our case, we were looking in Libya to update the coping strategies index for the Libyan context. So we wanted to use FGDs. Typically, it's done with in-person FGDs to determine what was going to be an appropriate list of coping strategies for the context that we're in. Obviously, in person wasn't possible, so instead we moved to do online FGDs. And because we were dealing with a whole list of coping strategies, we chose text-based. And as mentioned before, we really didn't have a choice other than asynchronous communication if it was on an online platform. So we ended up developing our own message board style discussion platform with a Tunisian startup here. So many of the platforms that are already available, as they do exist, either did not exactly meet our sort of either data privacy requirements that we had, or they couldn't accommodate Arabic or whatever barriers we had. So we had our own platform developed, and then we structured our FGD around 4 questions that were asked sequentially. So only when the majority of participants had answered a question, we would open the next question, And the questions consisted of a mix of polls and open discussion questions, which we sort of interchanged also to make it a bit more interesting for the participants to keep engaging with us. All in all, each component, so each question would take about 4 days to complete. So that was the time that it would take for all participants to log on at least once and respond to the question. For discussion components, this typically took a bit longer still, as we wanted participants obviously to also engage with each other and respond to each other's answers and really get this discussion going. So we typically needed more time, especially in some case, there might be a power outage in some region for a few days, and then obviously we had to postpone. So that's very briefly what we did. There's some key benefits and key challenges that I just want to highlight before closing. And these are benefits that we experienced, but are also, I think, generally applicable when you're thinking about doing online FGDs in these kinds of contexts. So main benefit that we found, or one of the main benefits, is that we were able to have participants, both male and female participants, in the same group without gender dynamics being an issue, as all participants were anonymous. We also were able to get non-biased answers, which I think in an FGD is quite unique. It's with an in-person FGD. Typically, the first person to ask a question will set the tone for how questions are answered. But in this case, we were able to set up our platform in such a way that people would only be able to see other people's answers after they answered themselves, which I think was a very valuable feature of this online FGD. Key challenges, I think the main one that I'll just highlight here is related to maintaining engagement. So when you're doing the kind of asynchronous FGD that we did, it can take quite a long time. Our FGDs would take up to a month, which means that we continually had to engage with our participants outside of the platform to encourage them to log on, to voice their opinions on the platform, and to do this continuously. So I think moving forward, when doing online FGDs in any context, this will be one of the key challenges to address, to really make at least asynchronous online FGDs a success. And I will leave it there, everyone.
Thanks a lot, Malay, and definitely thanks for highlighting both the benefits and challenges so clearly, but also really showing that this is a solution, and it's something that I know you're already considering also for future use, even if there might be possibility to get access back to the population. All right, so that's all we had from our panelists, but we will now open for questions. I can see there's been a lot of questions for you, Matthew, that you have already answered, but maybe just to pick up on the last one, essentially about just considerations of inclusion. I think you already mentioned in your presentation that there's a lot about access to SIMs. There's been a few points about language barriers, literacy. I'm curious if you have anything else to add to that, and also if there is one specific access issue that makes this voice ID technology completely non-applicable, let's say, beyond, of course, what you've already stated. So over to you, Matthew.
Yeah, so I guess the voice ID one is quite specific in that it's a verification requirement. So I think it's less useful if you're not verified. And to be honest, I think it works because everyone has a SIM card. So if you're not using mobile money for a cash program, or if it's not a mobile enabled banking solution or a digital solution, then I wouldn't suggest using it. The IVR question is, in terms of data collection, is quite I would say less innovative. People have been using IVR for surveys for a while, but yeah, a few questions came through. So language and inclusivity, although language is being one element of inclusivity, it's just understanding the population want to know, and understanding who won't be able to access your services. And so there are a number of angles. It can be access to SIMs, access to handsets, and then on top of that, access to energy, the ability to speak freely when being asked questions are all things that are important to think through. If it's not already available in your context, I guess worth a plug for the tool that we created with Reach and the ETC recently called the Conjurer Toolkit, which is a set of tools to help gather that information. And whilst to gather information on phone access requires face-to-face fieldwork by nature, which is kind of antithesis to the point, understanding who your audiences are and who isn't available is hugely important, because it speaks to how representative your data is and speaks to what other exercises you'll have to do to get to the people whose voices you're not getting. So unfortunately, I can't give a golden bullet solution. It's super context specific, and it's about taking the time to know who you're trying to speak to. But in lots of contexts, there is lots of good data. Again, if you the GSMA website, we have plenty of information on a number of contexts around this. And always reach out with questions we're happy to ask. I did see the question asked about cost. Unfortunately, how long is a piece of string? It depends on a whole number of factors. So I can't speak to cost within the time allowed, but worth speaking to suppliers. So if you work with operators already, they can help. Also, there are a number of great kind of research suppliers, so people like Geopol or Viama who do this as a specialism, so can also help you on that front as well.
Great, thanks, Matthew. And I think you answered all the other questions really well. I think also just, as you said, worth highlighting when something's applicable or not. A lot of these come with context. I think that's something that's come through all four of your presentations, that it's, it's a context relevant discussion. What is your research questions? What is the access you need? And then you pick your solution based on that. So I don't think there is a gold standard or one size fits all solution. On that, while we wait for other questions to come in, maybe a question for you, April, because both with Louisa and Melly's presentation, I think there were some overlaps in terms of the types of challenges of who you could reach with these online methods. And I'm curious with the phone-based kind of remote surveys, especially with the research that you were doing last year, if JPAL or your researchers had specific similar experiences as well, and where you had to kind of maybe drop the idea of a remote survey because you wouldn't be able to answer the research questions by looking at that. I hope that's clear. So curious to hear from you, April.
Sure, yeah. I mean, I think there are certainly plenty of places where we had to sort of stop and critically assess whether or not it made sense to make the transition from from in-person field-based surveying to remote surveys. So thinking through questions of access, was there high enough mobile phone penetration or other forms of internet-based services that enough of the respondents in our sample would actually have access to, that we were able to actually conduct a survey and have a sufficient sample size where it was worth kind of the investment of continuing to fund that research. So plenty of questions. I think we would sort of decide that it made sense to just pause and wait for things to improve before going in to resume field surveying once it was safe to do so. And I think that's especially important for thinking it through some of these more sensitive topic areas. So gender-based violence is certainly one of them. I think there are ways of being able to conduct remote surveys in ways that really strive to protect the security of respondents. But for instance, doing research on in conflict and fragile settings where you're talking about really complex issues, including reconciliation, restoring social cohesion, things like that after conflict. It can be really challenging to think about how do you ask those types of questions over the phone in a way that's really going to elicit truthful responses, and people are going to be receptive to responding to. So I think in some cases, just the switch to remote surveying isn't really feasible, and so it has to be kind of a case-by-case basis.
Great, thanks, April. And I'm glad to see our experiences also from Impact or Reach last year really overlap with that as well. We had to take a lot of those decisions and with regards to phone-based surveys. I don't see any other questions, but maybe Emmanuel, who's been monitoring the chat, please do jump in if not, because otherwise I would like to ask my own concluding question to the panelists. But Emmanuel, if there are any other questions you see on the chat, please let me know. The Q&A is still very much open, but to keep the discussion going, I will ask my question, I guess. So as I was saying right at the beginning, right, we're looking at lessons learned, but we're also looking at the way beyond. So I'd be curious to hear from all our panelists. Maybe we can go in the reverse order of how we started. So starting with Melly and then Louisa, Matthew, and April. Just to kind of understand, the kind of examples and solutions you've highlighted, are you or your organizations considering bringing this forward? And if yes, what is the one challenge to kind of keep in mind when you go and how you'd mitigate that challenge for all to standardize or systematize this for future research efforts. So Mele, over to you on that question, and then we can, I guess, go the other way.
Right, thank you. So in terms of whether we're going to bring it forward, certainly we're looking into different ways in which we can use the platform. As we have the platform now, it's like we might as well use it for as long as there's restrictions related to COVID, but also generally if we're trying to reach hidden populations. Online FGDs, I think, could be a really good alternative. The key challenge, I already mentioned briefly, I think, will be if we're doing these asynchronous discussions, making sure that our participants are engaged for a month or however long it's going to take. I think the way to deal with that is I think we might be able to shorten the overall duration by limiting the different kinds of questions asked. I think there's some ways that we could deal with that, or make sure that the sort of discussions are moderated in a way that they wouldn't have to take as long. Another way that we could be looking into is how we might incentivize participation in a different way, and also how to automate engagement with the participant. So it's not someone in our team constantly following up, but instead linked to the platform have, say, text messages that will, whenever a new question is posted or whenever a certain amount of answers have been provided in a discussion, an automatic update is provided as a way to have sort of constant engagement with the platform and encourage people to log on and provide more answers.
Great, thanks, Mela. That's very, very practical and sounds reasonable, and should be a solution to bring forward easily being a relative word, obviously. How about you, Louisa? And IDMC, you already mentioned you've started exploring this in other contexts. So what are your thoughts on this?
Yeah, definitely. So as I said, we're already actually undertaking a study using the same technology, but in a different displacement context. And we're definitely eager to keep trying it out and obviously refining the methodology as we go. In terms of one of the main challenges, this came up in a few of the interventions, is that particularly with the use of the online survey, it's important to remember that it's very short in design, and it's meant to be that way to try to maximize engagement of responses and reduce dropouts. So in that sense, it really gathers more top-line information, and the number of questions that you can include in a survey are really limited. So I think that's something to remember. And of course, as has been said, there's still going to be an enormous value in conducting in-person surveys, particularly, for instance, to gather some of the most marginalized groups, such as persons with disabilities who may not be able to engage with these types of surveys. However, there are some things we can do to overcome this challenge about length. So in terms of our socioeconomic impacts survey tool, one idea that's come up is that we break it up into different modules. So the original survey tool that I mentioned at the start of our intervention looks at the impacts on health, livelihoods, housing, education, and security. And the survey we conducted in Yemen covered those 5 areas. And so one idea is to break up the socioeconomic impacts into different modules and have separate surveys that we randomly distribute amongst the respondents. So that would mean, obviously, that it would be ideal to have a larger sample size, so there are still enough respondents responding to the survey on education or housing to be able to compare them. But we still think that that's an effective way to perhaps find more in-depth questions and information on those particular areas.
Thanks a lot, Louisa. That's really insightful also for me. Matthew, I mean, I know you said voice ID technology was already in use before, but anything to add on kind of bringing the solution forward and mitigating the challenge?
Yeah, so on the voice ID piece itself, a good team of my colleagues who are better able to speak on some of these than me, but they're working to take what was a pilot project across the other regions of Somalia, so working with the same partners and others to take it to scale, and also looking at moving into new markets where mobile money cash is prevalent. On the broader piece of kind of remote and technology-enabled research, it's something we continue to look at. My colleagues are super interested, and I guess, not to sound like a broken record, but I guess to come back on the reflections, which is to make technologically supported, so be it phone or internet or however you're looking at research work, you just need to understand as much as possible how people access and use the technology to start with. If you don't know that, then you have no idea how representative your surveys are. And again, it comes back to the kind of questions you want to ask. If you need to ask people how they use that certain technology, you shouldn't use that technology to ask them, because you won't get people who don't use it by default. So there's a lot of nuance to doing this. And I think it's about, and we continue to do so internally at the GSMA, thinking about, will the method distort the answers, and do we know enough about the people who we want to represent the stories of, essentially, which is what research is, to do it well. And if the answer to those things are no, then it's about taking a hard decision and thinking, can we do it differently, or do we do it at another time when maybe face-to-face becomes an option? And I think, yeah, with all this, we're about digitization, but the biggest word we say is appropriate digitization. So I'm thinking about whether or not the methods you've got are appropriate for the communities you want to speak to.
Thanks, Matthew, and also, of course, highlighting the importance of understanding access to technology or the digital solution you're considering. And I saw you also shared the link to the Conjurer Toolkit, which we worked on together with GSMA from Impact/Read site. So definitely, I guess, one way of filling that information gap as well, at least on phone networks. I see a couple more questions coming in, but maybe April, just for your reflections on this, and then I'll close with one last question from the chat.
Sure, yeah, I first just fully agree with everything the other panelists have said in terms of thinking about access and length issues and all of these different topic areas. I completely agree. I think for us, what I'm sort of interested to see and hopeful of is that we will continue as at JPL and our network to try to leverage remote surveying to the extent where it is a feasible solution in the context in which we're working. I think there are a lot of really important lessons that we've learned through these processes in terms of trying to reduce the amount of time that we're really asking of respondents by focusing in on what are the most important questions that we're asking. So as I mentioned earlier, often when you're going to the fields, you go with these incredibly long surveys where you're asking about everything under the sun. And it's really difficult often for people to sort of parse out what are the most important questions. And so I think having this exercise where, you have to be piloting and testing and really honing it into the information that is really most pertinent and preserving people's time, I think is a really important and valuable lesson for carrying out future research. And one other thing that I think is quite interesting to think about too is also, I think a lot of new research has been coming out of just trying to think more about not only using remote technologies for surveying, but also for delivering different types of quick interventions, whether that's information interventions, like some of these intimate partner violence programs we've seen, or if it's, excuse me, or if it's remote learning types of interventions, like sharing short exercises for parents to do with their kids. I think there's a lot of innovative things that are happening that are quite easy to implement, and a lot of researchers are looking to see how effective those things are versus kind of more traditional in-person approaches. So I think there's a lot of valuable research that's still to come out that will sort of inform future programming in a lot of different sectors.
Yes, definitely. Thanks, April, ending us on a great note there. But I definitely agree that there is so much opportunities to be seen from the lessons we've learned, and a lot of interesting research coming out as well about the applicability of different methods and different solutions that are worth considering. So we have 5 minutes, and a lot of interesting questions have come in, but I will pick one, or let's say two, that are kind of related. They're again around the issue about randomization of remote surveys. So that's one. So Louisa, you also already touched on this a bit before when you said, we acknowledge that the surveys were representative of adults that were over 18 and with access to internet, right? So the randomization only happens within that population, and you obviously will not be able to represent the entirety of the population of interest. So I think that was a good answer, but I'll let you see if you have anything to add to that. And then also April, if you have anything to add on this as well, in terms of ensuring more randomized respondent selection. The second question is for everyone, and whoever wants to take it, is how are you ensuring that you're reaching your target respondents? Is there a way to kind of monitor fraud, data falsification? Did you have to put in, let's say, for us, for example, we did have to put in additional data quality checks when we were doing phone surveys. But of course, it is a concern that you might not be getting answers from who you're expecting, especially if you remove the in-person enumerator in between. So those are the two questions. And I don't know, Luisa, if you want to start on the representativity issue, and then anyone else wants to come in on the fraud and kind of ensuring data quality. Thanks.
Great. Yeah, thanks, Nayana. So as you mentioned, all internet users in Yemen above the age of 18 had a equal random probability of stumbling across the survey, which pops up on any domains on the internet that RUI owns. So in that sense, it was very random in terms of who it could reach. But interestingly, we were concerned that given the internet-based method, it might exclude people who are in a lower socioeconomic group who may not be able to afford internet connection on smartphones or desktop devices. But interestingly, we actually found that when asked whether or not the IDPs or non-displaced people could meet their basic needs, a very high proportion of respondents said they were struggling to. So around 48% of IDPs said they were facing much difficulty in meeting their household's basic needs, which seems to suggest at least that we did get quite a broad cross-section of people in terms of socioeconomic groups. We also we also weighted the figures collected in the data to adjust for age and sex and reflect the national population demographic in Yemen. So that's another strategy that we took.
Great, thanks, thanks, Luisa. And I think this is from us as well with impact or reach is something definitely we struggled with as well with the time available. I think there are solutions to achieve full randomization, but considering, I think April said at the beginning that there are like policy and decisions, policy issues arising and decisions that need to be taken with COVID-19 emerging as well. We did have to kind of adapt and accept sometimes that full representativeness may be not possible while trying to find the best solution. So definitely a big challenge to keep in mind. So last question on fraud and how do you ensure you're reaching the respondents that you want to reach. And then I think unfortunately we will have to close. But yeah, let's see if any of the panelists have anything to add on this.
A quick one, I guess, and I see someone, Stella from Internews saying the same thing. It's if you have phone numbers listed against service users, then that's, I would say, as good as checking ID when face-to-face, unless the enumerator knows personally the person they're supposed to be speaking to, like knowing the name or having the phone number of someone on your list is probably as close as it gets. And if you don't have their phone number, if you're kind of going for random dialing, then it becomes less of a problem because you're not trying to speak to a named person. So I think it's about working from good record keeping. So that's, I think, before we get to the research question, it's about ensuring that your program records are good enough to make those approaches, and also making decisions around what kind of touch points you can make certain decisions from. It will also remove the impact of if you do speak to the wrong person.
Thanks, Matthew. How about any of the others? Anything to add on this?
I think I would sort of echo Matthew. Unfortunately, I don't know that I have a great solution here. I think to the extent that you can have strong records and using mobile phone data on phone numbers is definitely key. But I think the other thing to consider is just trying to think of whether or not there's any sort of systematic difference in fraud, or thinking about like the rate at which fraud is really going to affect the number of respondents that you're reaching out to. And so I think that's where you also consider how many people are you reaching out to, trying to kind of think about across different types of characteristics within that population, where there might be higher risk of fraud and things like that, and trying to make sure you're reaching out to enough people where fraud is probably not a huge concern.
Yeah, thanks, April. And I can see someone also posted on the chat about experiences from Internews in Kenya, I believe. Unfortunately, we are a minute over time, so we're not going to be able to answer all the questions, but maybe what you could do is send over the questions and we'll put you in touch with the panelists so they can follow up with you as well. I also want to just highlight one comment that came in from Colin earlier about the importance of language data when considering remote data collection or any kind of digital solutions. And that's of course quite important, both to ensure that you can actually reach the population you're trying to reach, but also effective two-way communication. So you're not going to have the data you need if you're not considering language into your data collection design, obviously. So thank you, Matthew, for pointing that out as well. So I think we'll leave it at there. Thank you so much to our panelists and everyone else for your active participation. As I said, if there are any outstanding questions, please do send them our way. Maybe, Emmanuel, you can post our contact details there, and then we'll forward you on or put you in touch with our panelists so they can speak more about their examples if you're interested as well. Thanks, everyone, and wish you a nice afternoon or day, depending on where you are. And thanks especially to all four of you for making the time. Bye.